Hello, this is Dr. Talal Khan from Personal Primary Care and Weight Management. I'm doing a segment of videos on COVID-19, and this is my third video. After the epidemic, we responded by doing televisits, and then we started introducing my Immune Boost Kit, which is the vitamins and supplements that you can take to boost your immunity. This most recent video is about a message of hope. A lot of my patients are feeling anxious, and rightfully so. This is an anxious time for all of us. However, there is light at the end of the tunnel. COVID-19 has challenged us in a way that most of us have never been challenged before. I run a small business, so I know how hard it is for all of us. However, we are fighting back, and we should fight back. But one thing we have learned from this is that we have been going too fast, sometimes at speeds of 70, 80 miles per hour, whereas we should be really cruising at 12, 20 or 30 miles per hour. The kids are home now. There are opportunities to homeschool them, to spend more time with them, to play with them in the yard, to get more sunlight, to get more exercise done, all of which is the central philosophy for personal primary care and weight management, because we believe in lifestyle and prevention. COVID-19 has slowed everything down. Maybe it is time that we reevaluate things on how fast we had been going before, and maybe we need to slow down as a society. This is profoundly impactful on so many things. We manage high blood pressure, cholesterol with medications, but maybe it is time that we reevaluate much earlier how our immune system is. If you see the trend with COVID-19, it is patients who are sicker, who have diabetes or prediabetes or COPD, or congestive heart failure, that are more likely to succumb to this virus than anything else. So the message of hope is that we learn something from this and be ready in a more robust form after this crisis is over. Learn to take better self-care and care for our family members and everyone else around us. Lastly, I'm extremely happy to announce that Quest Diagnostics has come up with a much awaited serological way of testing COVID-19 in your bloodstream by Immunoglobulin IgG antibodies. The test is going to be drawn at patient service stations that Quest has throughout the country, I'm told by the end of the week, and in Massachusetts and Northern Connecticut as early as Wednesday. I'm excited because this would tell us whether you have been exposed to the coronavirus by a simple blood test. How it should be interpreted, it depends on whether you have symptoms. Obviously, if you have symptoms and you are short of breath, you are coughing, or you have a fever, then you must talk to your healthcare professional and then go to the hospital or urgent care and be tested if needed. But if you might have been exposed and you want to know whether you had the disease, an IgG test, which is a blood test, is right around the horizon. As more testing gets available, we could think about a time when we will open, obviously following the state guidelines by your officials and by the CDC, and wearing masks and protecting ourselves and doing social distancing. But we miss seeing each other. And social distancing has also taught us how important social connection is, another cornerstone to lifestyle medicine. So I'm extremely hopeful as we go further, and spring is on the horizon, and hopefully we will beat this together.